Hello my YouTube friends and health enthusiasts. Welcome back to my channel, where I dive deep into the world of wellness and nutrition. My name is Nikolai Ninev. I am a certified food expert and pharmacist. Today, I am exploring a crucial yet often overlooked vitamin, vitamin B1, also known as thiamine. Vitamin B1 plays a vital role in maintaining a healthy body, but what exactly does it do? And why is it so important for our well-being? In this video, I'll dive deep into the world of thiamine. I'll explore its functions, the importance of including it in your diet, and the signs and consequences of thiamine deficiency. Whether you're a health enthusiast or just curious about improving your diet, this video has got you covered. Don't forget to hit the subscribe button and ring the bell for more health and wellness insights. Let's discover the world of thiamine together. The magic of thiamine, exploring its vital functions. Vitamin B1, also known as thiamine, is one of the 8 essential B vitamins. It was the first B vitamin to be discovered, hence its name. Like the other B vitamins, thiamine is water-soluble. That means that it dissolves in water and isn't stored in your body, so you need to consume it on a regular basis. In fact, your body can only store around 20 days' worth of thiamine at any given time. Vitamin B1 is absorbed in the small intestine, specifically in the jejunum and ileum, through active transport and passive diffusion. Alcohol consumption and some medications, for example, can affect the rate of absorption. Once absorbed, thiamine is transported to the liver via the portal vein, where the liver plays an integral role in its metabolism. Thiamine is crucial for the growth, development, and function of the cells in your body. It helps in the maintenance of a healthy heart and supports the functioning of the cardiovascular system. It also plays a role in the prevention of cataracts and can slow the progression of Alzheimer's disease. Vitamin B1 is an essential nutrient that all tissues in the body need to function properly because it is involved in many key metabolic processes in the body. Thiamine plays a crucial role in the body's energy metabolism as a coenzyme, specifically in its active form, thiamine pyrophosphate, TPP. It is crucial in several key metabolic processes, particularly in the conversion of carbohydrates into energy. This conversion occurs primarily through the Krebs cycle, also known as the citric acid cycle, a fundamental pathway in cellular respiration. In this cycle, glucose is oxidized to produce adenosine triphosphate, ATP, which serves as the primary energy currency of the cell, fueling various cellular activities. This process is vital for the proper functioning of the heart, muscles, and nervous system. One of the essential roles of thiamine is in the metabolism of pyruvate, a key sugar utilized by the body for energy production. Pyruvate is a product of glycolysis and is a precursor to the Krebs cycle. Thiamine, as thiamine pyrophosphate, facilitates the conversion of pyruvate into acetyl coenzyme A, an important step before entering the Krebs cycle. This conversion is vital because it allows for the efficient generation of ATP from carbohydrates. However, when there is a deficiency of thiamine, the metabolism of pyruvate is impaired. As a result, pyruvate accumulates in the bloodstream, which can lead to a range of health issues. This accumulation is because the body is unable to efficiently convert pyruvate into acetyl-CoA, thereby hindering its entry into the Krebs cycle. Consequently, the production of ATP is reduced, leading to decreased energy availability for the body's cells and potentially causing symptoms associated with thiamine deficiency. Additionally, thiamine plays a significant role in nerve function. It is involved in the production of the neurotransmitter acetylcholine, which is necessary for transmitting messages between the nerves and muscles. By doing so, it helps maintain a healthy nervous system and supports cognitive functions. It also aids in the synthesis of myelin, a fatty substance that insulates nerve fibers and ensures the rapid transmission of electrical signals. Thiamine is also crucial for the metabolism of amino acids and lipids. It is involved in the breakdown of branched-chain amino acids, which are essential amino acids that the body cannot produce on its own. In lipid metabolism, thiamine is involved in the production of fatty acids and cholesterol. Thiamine also plays a crucial role in maintaining a healthy digestive system. It aids in the production of hydrochloric acid, which is necessary for proper digestion. In addition, it helps in the absorption of other nutrients in the body, ensuring a balanced and efficient nutrient intake. Moreover, thiamine is involved in the production of red blood cells, which carry oxygen throughout the body. This function is essential for maintaining good cardiovascular health and preventing anemia. Lastly, thiamine plays a role in maintaining the health of the heart and the cardiovascular system. It is involved in the production of nucleic acids, the building blocks of DNA and RNA, which are essential for cell growth and division. This is particularly important for rapidly dividing cells, such as those in the heart and blood vessels. What is the recommended daily intake of thiamine? The recommended daily intake of vitamin B1, also known as thiamine, varies depending on age, sex, and life stage. For healthy adult men aged 19 years and older, the recommended intake is 1.2 milligrams per day. For healthy adult women aged 19 years and older, the recommended intake is 1.1 milligrams per day. During pregnancy and breastfeeding, the recommended daily intake increases to 1.4 milligrams. This is due to the increased demands of the growing fetus and the needs of the infant. For children, the recommended daily intake varies with age. Infants up to 6 months need about 0.2 milligrams, while infants 7 to 12 months need 0.3 milligrams. Children aged 1 to 3 years require 0.5 milligrams, those aged 4 to 8 years need 0.6 milligrams, and those aged 9 to 13 years need 0.9 milligrams. For adolescents aged 14 to 18 years, the recommended daily intake is 1.0 milligrams for girls and 1.2 milligrams for boys. The National Institutes of Health has established these recommendations in order to accommodate the majority of people in the general population. However, individual needs may vary based on overall health status, lifestyle factors, and dietary restrictions. Thiamine deficiency, the symptoms you should never ignore. Thiamine deficiency is a condition that occurs when the body is not getting enough of this essential vitamin. This can happen due to inadequate intake, increased requirements, excessive loss, or impaired absorption. Certain populations are more at risk, including people with alcohol dependence, those with malabsorption syndromes, individuals on long-term parenteral nutrition, and those with a diet high in processed foods. The consequences of thiamine deficiency can be severe and potentially life-threatening. The symptoms of thiamine deficiency can vary and may be subtle at first. Early signs include fatigue, irritability, poor memory, sleep disturbances, and abdominal discomfort. As the deficiency progresses, more severe neurological symptoms can develop. These include Wernicke-Korsakoff syndrome, often associated with chronic alcoholism. Thiamine deficiency, also known as beriberi, can manifest in a variety of ways due to the essential role that vitamin B1 plays in the body. Beriberi can affect the cardiovascular system, wet beriberi, the nervous system, dry beriberi, and the digestive system, gastrointestinal beriberi. One of the first signs of a deficiency can be fatigue or weakness. This is because thiamine plays a crucial role in energy metabolism and the growth, development, and function of cells. Without adequate thiamine, the body struggles to produce energy from food, leading to weakness and tiredness. It can also affect the nervous system, causing problems with coordination and balance, which is known as dry beriberi. Dry beriberi affects the nervous system, resulting in tingling or numbness of the hands and feet, confusion, difficulty speaking, trouble moving the legs, pain, muscle weakness, and, in severe cases, peripheral neuropathy. Cognitive issues can also indicate a thiamine deficiency. This is because thiamine plays a critical role in nerve function and the production of neurotransmitters that regulate mood. Symptoms can include irritability, depression, and anxiety. In more severe cases, thiamine deficiency can lead to wet beriberi, which affects the cardiovascular system. Symptoms can include shortness of breath, swelling in the lower legs, an enlarged heart, and an increased heart rate. If left untreated, it can lead to heart failure. This is because thiamine is essential for maintaining the health of the cardiovascular system. Thiamine deficiency can also lead to gastrointestinal beriberi, which affects the digestive system. Thiamine is necessary for the production of hydrochloric acid in the stomach, which is essential for digestion. Symptoms can include loss of appetite, abdominal discomfort, nausea, vomiting, constipation, or unexplained weight loss. Another type, acute beriberi, is found mostly in babies. Infantile beriberi usually occurs between 2 and 6 months of age in children whose mothers have inadequate thiamine intake. That's why breastfeeding mothers need daily thiamine in their diet. Infants drinking breast milk or formula low in thiamine are also at risk for thiamine deficiency. It may present as either wet or dry beriberi. The symptoms can include loss of appetite, vomiting, lactic acidosis, changes in heart rate, and enlargement of the heart. Thiamine deficiency is also more common in cancer patients. Restrictive diets, eating disorders, and inflammatory bowel disease can also cause thiamine deficiency. In extreme cases, dry beriberi is associated with Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome is a serious brain condition that is usually, but not exclusively, associated with chronic alcohol misuse and severe alcohol use disorder. Wernicke-Korsakoff syndrome involves two different brain disorders caused by thiamine deficiency. They often occur together, Wernicke's encephalopathy and Korsakoff's psychosis. They result from brain damage associated with alcohol use disorder combined with thiamine deficiency. Wernicke's encephalopathy damages regions of the brain called the thalamus and hypothalamus. This condition can cause mental confusion, memory loss, low blood pressure, difficulty with muscle coordination, and visual problems such as rapid eye movement and double vision. Korsakoff psychosis is the result of permanent damage to the region of the brain where memories form. It can cause loss of memory, an inability to form new memories, and hallucinations. Korsakoff psychosis occurs in 80% of untreated patients with Wernicke encephalopathy. If beriberi progresses to Wernicke-Korsakoff syndrome, the outlook is poor. While treatment can manage the symptoms of Wernicke encephalopathy, brain damage from Korsakoff psychosis is often permanent. In conclusion, without treatment, Wernicke-Korsakoff syndrome can be disabling, produce permanent memory loss, and be life-threatening. Thiamine deficiency is diagnosed through a physical examination, a medical history, and blood or urine tests to measure thiamine levels. Treatment typically involves thiamine supplementation, either orally or through injections, depending on the severity of the deficiency. Prevention is key when it comes to thiamine deficiency. This involves consuming a balanced diet rich in thiamine-containing foods, avoiding excessive alcohol consumption, and ensuring adequate thiamine intake in situations of increased requirement or loss. In some cases, thiamine supplements may be recommended, especially for those at high risk of deficiency. With early detection and treatment, most symptoms can be reversed. However, if left untreated, thiamine deficiency can lead to severe health complications, including irreversible nerve damage and death. Dietary sources rich in vitamin B1. Vitamin B1, also known as thiamine, is an essential nutrient that the body cannot produce on its own. Therefore, it must be obtained from the diet. There are several dietary sources rich in vitamin B1 that can help meet the daily recommended intake. One of the richest sources of this vitamin is yeast and yeast extracts, which are often used in the production of bread and other baked goods. Whole grains are one of the best sources of thiamine. These include brown rice, whole wheat, oats, and barley. These grains are not only rich in thiamine but also provide other essential nutrients like fiber, iron, and magnesium. When grains are processed into white flour or rice, much of their thiamine content is lost, which is why many countries fortify these products with the vitamin. Lean meats, especially pork, are also high in thiamine. Other meats, like beef and liver, are also good sources. Poultry also contains vitamin B1, but in smaller amounts. It's important to note that the thiamine content can decrease with cooking, so methods that minimize nutrient loss, like steaming or roasting, are recommended. Legumes, such as lentils, black beans, and soybeans, are another excellent source of vitamin B1. They are also high in protein and fiber. They are a great source of vitamin B1 for those following a vegetarian or vegan diet. Fish, especially trout, salmon, and tuna, are rich in thiamine. They also provide a good amount of omega-3 fatty acids, which are beneficial for heart health. Nuts and seeds, including sunflower seeds, flax seeds, and macadamia nuts, are packed with thiamine. They are also a good source of healthy fats and protein. Several fruits and vegetables also contain thiamine. Asparagus, Brussels sprouts, and spinach are among the vegetables with the highest thiamine content. Some fruits, like oranges and other citrus fruits, also contain small amounts of vitamin B1. Dairy products like milk, cheese, and eggs also provide thiamine. However, the amounts in these foods are relatively small compared to other sources. Finally, fortified foods such as breakfast cereals and breads often have added thiamine. These can be a convenient way to increase your vitamin B1 intake, especially if your diet lacks other sources. Incorporating a variety of these foods into your diet can help ensure you get enough thiamine. However, if you're concerned about thiamine deficiency, it's best to consult a healthcare provider who can provide personalized advice based on your individual needs. And that's a wrap on our journey through the fascinating world of vitamin B1, thiamine. It's incredible to see how this one vitamin can have such a profound impact on our health, isn't it? I hope this video has given you a deeper understanding of thiamine's crucial functions, its importance in your diet, and the potential risks of deficiency. As always, I remind you to consult with your healthcare provider before starting any new supplement regimen. Your body is unique, and what works for one might not work for all. If you've enjoyed this video and found it informative, please give it a thumbs up and share it with your friends and family. And as always, if you have any questions or want to share your experiences, feel free to leave a comment down below. I love hearing from my viewers. Your feedback is invaluable and inspires me to keep creating informative content. Thank you for watching, and remember, your health is your wealth. Stay well, stay healthy, and take care. Until next time.